Hey guys, welcome back to Born in Faith Childbirth Education Discipling Families. Last lesson, we talked about environmental interventions and how that can play a role in the way that you give birth and your birthing experience. Today, we're going to talk about routine medical interventions. And basically, what that means is these are common steps that will happen in a hospital setting birth, especially one that is heavily medicated, going with the flow, maybe no birth plan. This is just things that are going to happen to you if you don't communicate, don't know how to say yes, don't know what to say yes to, what to say no to, you don't really know what you want. Like, this is kind of like the common stuff. If you don't talk about it with your provider, even some stuff, even with midwives, like this can happen, birthing centers, right? Even though birthing centers and midwives are more intervention free, but these are still some things that can happen. But this is mostly in the hospital setting, things that you can expect routinely. So let's get into it, right? So routine medical interventions, cervical checks. So it's like the biggest number one thing, right? It's one way to check if you're quote unquote progressing in labor, even though they can check you and be a 5 centimeters and then within an hour you can be fully dilated. So it doesn't really tell you when you're going to give birth. Like, there are moms who are like 3 centimeters dilated before they're even in labor. So, but this is like routine. You're gonna get checked as soon as you go into the hospital to be admitted, to even check if you're in active labor, right? They're gonna check. They'll usually admit you if you're around 6 centimeters or 4 centimeters, contractions are picking up. That's usually what I've seen. If you're under that and your contractions are super wonky, they're not going to admit you. They'll send you back home unless like your water is broken. Then of course they're going to keep you, and they're going to try to augmentate labor. The cervical checks are routine. They will come and check you if you don't say no throughout your labor in the hospital, especially if you have the epidural or if you have Pitocin or if you're induced, they will check you. You can always say no. You do not need to be checked. There are risks that happen, right? Like your cervix can swell the more they mess with it. Infections can happen, especially if the water is ruptured. So you want to keep those at a minimum. Obviously, of course, they happen with your midwife as well. If it's something that labor has been going on for a while and they want to see where you're at to see what else they can do, that is always an option for you to, to do, to say yes or no to. So then the next medical routine that we have is IV ports, IV fluid, right? That's when they stick the little needle on you. You can advocate for yourself, and if it's uncomfortable, like you can tell them like, hey, can you put it here instead? You're allowed to do that. You're allowed to not be hooked up to the IV and just have the lock just placed in you. You can do that. If you receive too many fluids, it could lead to swelling and engorged body and can even increase the weight of your baby. So when your baby is born, the weight will be more, but babies automatically lose about 10% of their birth weight once they're born, right? So they lose more than the 10%, and there's a cause of concern, and then they start recommending formula. So this is just something to be mindful about, that these are things that can happen. Another intervention that they use is they limit foods and drinks. A lot of hospitals will not let you eat. They'll just keep you on ice chips. Some don't even say water. And of course, usually moms during active labor don't feel like eating. So make sure you're at least sipping bone broth or something with electrolytes. It is very common, which it can lead to exhaustion, getting the epidural. It can even prolong labor. This is like it's a marathon, guys. It's very taxing on the body. Of course, like, you're not always going to want to eat, but it's good to still have something to drink, right? And that's kind of why they introduce fluids, because they're not allowing you to eat or to drink, right? So then we have induction. So induction is when they force labor to start. You have no signs of labor. This can last a few days. There's cytotec, there's pitocin, there's Foley bulb. This can cause hyper uterus contractions. So the more pitocin they pump into you, it can lead to a uterine rupture and a C-section because you're overstimulating the uterus, which is not good, which is what causes the baby to go into distress and can lead to a C-section. So you want to be mindful when you say yes to these interventions, because they are not the best. And of course, it can happen if your body hasn't gone into labor and your OB puts you on a clock. You know, if you're transferred from a midwife practice after 42 weeks, legally they cannot attend the birth and they have to transfer you. So this might be a reason why you get an induction. So don't be afraid of them. But definitely that 39-week induction is usually not your best bet. Pray about it. This is not medical advice. This is for you to know, use wisdom and discernment, and to pray about it and, you know, ask the Lord what's the best route for you. We have continuous fetal monitoring. So this has not been proven to have better outcomes for the baby. It actually increases C-section and leads to augmentation of labor. So augmentation of labor is, right, labor already started, but they need to either speed it up or maybe contractions stalled. So they need to pick them back up. And they do have wireless fetal monitoring. Some hospitals, sometimes they don't have enough. So always check with your provider what's available in your hospital. Make sure you're touring the hospital. They don't really have this in birthing centers. And then of course they don't have this in a home birthing setting. This is hospital setting, right? So then we have epidurals. Of course, 60% of women get epidurals. Partner may have to exit if you do decide to get an epidural. Some hospitals let the partner stay in the room. You still need support to move in the bed because you'll no longer be able to use like the bottom half of your body. You do need help to get into position so labor can continue to progress. Sometimes an epidural is exactly what you need so labor can progress, especially if you've been in labor for a long time. Maybe you're just holding a lot of tension, and then an epidural will help you relax and help labor move along. So I'm not against it, but I'm more about let's use this intervention wisely and to our benefit, not something that we can rely on because it's not always going to work. And like we said, right, leaving your house is an intervention. So if you want an unmedicated birth, you want to make sure that you're mentally prepared to to labor at home without an epidural, unmedicated, so that you can achieve your unmedicated birth goal. So if your goal is to get an epidural from the get, okay, then, you know, find the risk, the benefits, and do you, girly. There's nothing wrong with that. I just don't recommend it as your one all be all because it might not always work, and you should still learn how to cope with your contractions and your body sensations that are happening and not get disconnected from what's happening to you. So really your mindset is super important. The next one, augmentation with pitocin, right? If your contractions stall, there's hyperuterine stimulation, can cause postpartum depression, can even cause postpartum hemorrhage, even though it's a medication used to stop postpartum hemorrhage in home birth settings. Sometimes they'll give you like a pitocin shot, but yeah, a lot of it can harm you really bad. And then the next intervention that we have is pushing on the back. So this does not allow the pelvis to open up properly and can cause baby not to descend properly. You have to advocate for another position. And this can also cause the baby's heart rate to decline because baby is not in a good position. You want to be able to be standing upright or all on fours because the baby is moving in your body as the contractions happen. They're wiggling their little way through the pelvis bones. So your pelvis needs the space to open up so your baby can get through and your baby can wiggle through. But this is something where it's really routine. They'll put you on your back. This even increases your risk of tearing. So talk to your providers. This is why, as you get more of the facts, why you'll know if you align with your provider or not, right? We have coach pushing. This can cause tearing of the perineum, and this can cause maternal exhaustion because you are not instinctively pushing, you're being coached to push. So basically the nurses can see when your contraction is coming, so they're going to tell you when to push and stuff like that. And it's just not instinctual. Your body has this thing where it's called like the fetal eject. I think that's what it's called. But basically, your body is just trying to push this baby out on its own, and this happens when you have an epidural or you're pushing on your back. So it's not the best thing, but it is routine, right? You have providers putting fingers in your vagina or massaging perineum. Supposedly, this can reduce pain, may reduce third and fourth degree tears. Research is a little wonky on that, but keep researching and see how you feel about that. This is usually why they have you on your back, which is not the best, but that's really what they're doing. And they're just, if you have an epidural, you really won't feel it as much. But yeah, it's not fun either way. So the next routine medical intervention is immediate cord clamping. They usually only give you 60 seconds. In a home birth, they wait till the cord is completely white and is not pulsating. There's about 2 ounces of blood in the cord. It increases iron storage for the baby and it gives the baby better brain development. So this is something you need to discuss with your provider, because most of them will say that they can only give you 60 seconds before they have to clamp it, cut it, and all that stuff. Cleaning baby is another intervention, right? Where they're just cleaning the baby off with the vernix. This is considered necessary if mom has B or HIV. It's also better to leave the vernix on and rub it in gently, right? So we have the third stage of labor, which is delivering the placenta. And if you're in a home birth, sometimes they will use Pitocin, but it takes 30 minutes to an hour for a placenta to give to birth. So like I wrote here, 50% of placentas birth within 6 minutes and 97 are birthed after 30 minutes. So making sure you communicate with your provider about what you want. And you also have to be mindful that your provider might not be on call when you give birth. So having that written on your birth plan and making sure that everyone in the room knows what you want is so important. A lot of providers, sometimes even home birth or birthing centers, they will pull on the cord, which is very not good. Uterine inversion can happen, very dangerous. Excessive bleeding can scar the tissue. You don't want them to do this. So make sure you talk to your providers, friends, because it's not fun. Then we have a fundal massage. So this is like, if you see it on Instagram, funny videos where like the nurses come in every hour to push on your uterus. It's supposed to help the uterus contract back to its normal size. It's supposed to help expel blood clots. It's very uncomfortable. You can opt out. A lot of nurses might shame you for opting out. So just be ready for that. Suctioning baby. So there's no real benefits to this practice, only helpful if there is an obstruction to the airway. So these are the common interventions. And actually one that I forgot to place here, so I'm going to just talk about it really quick, is them breaking your waters. That is something that they use they have a little hook. It's a little hook. They insert it. So always be mindful if you're getting a cervical check. Make sure you tell them, like, please do not break my waters if your waters are not broken, because once your water is broken, they do put you on the clock. You have to give birth within, I believe, 24 hours of your water being broken. So if your water breaks before contractions start, you have, I say, rule of thumb, 12 hours before you head into the hospital. See if contractions start on their own before you start an augmentation of labor on Pitocin. And then obviously keep minimal cervical checks. You cannot have sex because the water is broken and you don't want any infections to happen. So we're going to talk about how does this make you feel intuitively. Super important to, as you process this information, and please listen to this video a few times if you need to, because it is a lot of information. So if you feel overwhelmed, it's okay. But sit with the Lord, continue to research more. You can go on justtheinserts.com. You can go on, the OBGYN. You can research all these things and be educated. Ask the Lord, submit yourself to the Holy Spirit. At the end of the day, don't be afraid, guys. So this is it for today's lesson on medical intervention. Our next lesson is how to advocate during labor and early postpartum. Make sure you share this with pregnant mom and subscribe so you can get more childbirth education videos in a Christ-centered way.